There's a lot to unpack here. And so, one of the things I'll say is you touched on a couple of things. One is I'm going to guess that you've done some work in unpacking the role of your family on your thoughts about
Yeah.
yourself.
Yeah.
So we call that the origin story. Like, where do you come from, and what's the impact of your, first
Hmm.
community, your family, your early schooling? And listening to you tell the story was the hint that you had unpacked it, because a lot of times you're unaware of the messaging that you get as a
Yeah.
young kid. So do you really remember? I mean, I'm not questioning your events, but I'm asking, was it through reflection of implied stories and examples around you, or do you remember people actually saying to you, "Hey, medical school is not for people like us"?
Yeah. Yeah.
Yeah, people
That was
really
the
said
message.
it. Okay, people really
Yeah.
said it.
There was a lot of you should consider being a nurse,
Okay.
was the message I got over and over and over again.
Which is
Um,
interesting because nursing school in 2025 is as expensive and intensive as medical school, I think.
it is. It's to date, I walk into a room to see a patient, and some people think I'm the nurse coming in.
Oh,
In the hospital, I would go approach a patient, and I could say I'm a medical student, and their immediate association was that this is the nurse. She's a medical student nurse, and
and you
when
think
I would
that's
say
still
no, no,
just gendered?
it still happens. It
Yeah.
it still happens. Sometimes I bring, so I'm a family physician, I bring patients into the room. So I'll go out in the waiting room, I'll call their name, I'll bring them in, and they think I'm the receptionist because I'm doing this.